Welcome to today's webinar, Understanding the BSMD Roadmap. Hi, my name is Dr. Rory Merritt. I'm the founder of Bridge to MD, and I'm a graduate of Brown University's 8-year BSMD program, known as the Program in Liberal Medical Education. When I applied to BSMD programs, I was overwhelmed with the numerous options, how competitive it was, the various requirements, and I really had no idea where to start. That's why I created this free webinar to help you stand out from the rest of the pack. Thank you for joining us. Let's dive in. Unlike the traditional pre-med path where students apply to medical school after college, BSMD programs allow you to secure your spot in medical school as early as high school. Some programs take 8 years, just like the traditional path. That was the path I chose. Some programs take 7 years or even 6 years, offering you the opportunity to save valuable time and money on your way to becoming a physician. But here's the catch. Not all BSMD programs are the same. Some let you major in anything, while others require a structured pre-med curriculum. Some don't require the MCAT at all, while others set lower MCAT score requirements than traditional applicants face. Understanding these key differences is key to helping you find the right fit. There are a few compelling reasons to choose a BSMD program. The most obvious is security. You lock in your seat for medical school right out of the gate, bypassing traditional medical school requirements. Another big draw is the accelerated timeline, saving both time and tuition. Additionally, BSMD programs offer specialized advising and early clinical exposure. I think this is the most important part of what BSMD programs offer, the ability for you to explore medicine in a safe environment and develop an early professional identity formation. Finally, these are tight-knit communities. These are small programs that allow students to form tight relationships with their peers. In fact, some of my very best friends to this day are friends of mine from my days back at Brown's Program in Liberal Medical Education. You should know that these programs can be intense and limit flexibility, so if you change your mind, it can be tough. If you're deeply committed to becoming a doctor, however, a BSMD program can be a great fit. BSMD programs are incredibly competitive. Some have acceptance rates lower than Harvard and Stanford. Why? Because they're looking for students who are already 100% committed to medicine and have the academics, the extracurriculars, and mindset to back it up. Most successful applicants have nearly perfect GPAs, top SAT or ACT scores, and significant medical experience. Things like shadowing doctors, working as an EMT, working as a certified nursing assistant, or volunteering in healthcare settings is critical. They also demonstrate leadership and community impact. Admissions committees don't just want good students. All of their applicants are excellent students. They want future healthcare leaders. If you've taken a second to check your email on another screen, here's where I want you to pay really close attention. BSMD programs are not just looking for top students. They want to admit future doctors who are fully prepared for the demands of an accelerated medical education. Admissions committees focus on 4 key areas. First, commitment to medicine is essential. They look for long-term, consistent engagement in healthcare-related activities, such as shadowing, clinical work, and research, as well as a compelling, experience-driven why medicine story. Second, they assess academic intensity and readiness for medical school. Since BSMD students must handle a fast-paced, rigorous curriculum, admissions committees expect a high GPA of at least 3.8, advanced placement or IB coursework, and top SAT or ACT scores, along with demonstrated success in challenging science courses. By the way, they're looking for SAT scores of at least 1500 and ACT scores north of 34 or 35. Beyond academics, motivation and resilience are critical. Medicine is a lifelong commitment, and schools want students who can push through challenges, demonstrate problem-solving skills, and show a genuine passion for learning. Finally, and I think this is the most important part, authenticity. It's so often overlooked. It's just as important as any other factor. Admissions committees can tell when a student is simply checking boxes versus when they have a true passion for medicine. Your application must tell a cohesive, genuine story about who you are, why you're drawn to medicine, and what impact you hope to make. In a pool of highly qualified applicants, authenticity is what sets you apart. A competitive BSMD application goes beyond just strong grades. It tells a compelling, authentic story that demonstrates your long-term commitment to medicine. As we discuss, aim for academic excellence. Take a very hard course panel and aim for excellent grades. You're going to have to shoot for competitive test scores to be a competitive applicant. However, academics alone won't set you apart. Depth in extracurriculars is crucial. Commit to meaningful clinical exposure, such as shadowing, hospital volunteering, or patient-facing roles. Patient-facing roles are highly valued and sought after by admissions committees. It's also important to pursue high-impact leadership in research, in community health initiatives, or mentorship. Your why medicine statement must be genuine and experience-driven, clearly reflected in your essays and interviews. BSMD programs, many of them, rely heavily on weight interviews. So practice multiple mini interviews and traditional Q&As to communicate your story with confidence, clarity, and authenticity. Additionally, research each program thoroughly to tailor your application to their unique mission and values. Ultimately, admissions committees aren't just looking for excellent students, they want future doctors who demonstrate passion, resilience, and a clear commitment to the medical field. It's true, the BSMD admissions process is one of the most selective in higher education, but with the right strategy, you can rise above the competition. It's not just about top grades. Admissions committees look for students with depth, impact, and a clear, authentic passion for medicine. Strong academics, meaningful extracurriculars, and a well-crafted personal story set applicants apart. If you're serious about securing your spot in a BSMD program, early strategic planning is non-negotiable. To make this process clearer, I've created a BSMD application checklist. You won't want to miss this. It's a one-page for students and for parents that outlines the critical steps to strengthen your application year by year. So it's helpful if you're a freshman, a sophomore, a junior, or even a senior in high school. This can be impactful. This is the exact roadmap high-achieving students use to maximize their chances of success. Please be sure to click the link to sign up and you'll get your free checklist right away. Your journey starts today, so let's make it happen.